have the COVID-19 pandemic since March last year, and the COVID impact has had a negative effect on blood safety activities in Uganda. As you are aware, most of our blood collections have always been from schools, which accounted for about 80% of our blood collections. But since the lockdown period, schools have been interrupted, they've been closed, communities have been interrupted, there has been limited movement. So it has been a very difficult period for UBTS to be able to collect blood, because now we have to rely on communities, we have to rely on faith-based organizations, we have to rely on corporates to be able to collect blood. We are very, very grateful for those MDAs, for the corporates and other stakeholders that have sustained the blood transfusion services during this COVID period. The communities have played a very big role. The village health teams have played a very big role in mobilizing blood donors from the communities. We thank the army, we thank the police, we thank the corporates, and we even thank those donors who have endeavored to come and donate blood whenever they are called upon. We had to devise new ways of working. We set up a call center. We are sending SMS messages. We are visiting small communities. And in this way, we are trying to make sure that we get blood to sustain our hospitals that need blood. You know, even if there is COVID, there's still need for blood for those mothers with the complications of pregnancy and childbirth. There are still road traffic accidents. We still have cancer patients. We still have sickle cell patients who need blood. And even then now, I think the demand is even more than what we have been supplying. So my teams, my staff work every day. They go out in the field, they go and camp, they collect blood to be able to sustain, to maintain our blood stocks, because every day we give out blood. I think you've seen in the lab, whatever we collect, whatever we process is given out to hospitals free of charge, both government and private, from the level of health center 4. I want people to realize, to note that blood is only given to those hospitals from health center 4s. Health center 3, health center 2 are not allowed to transfuse blood according to the policy of government. But I do give credit to my staff, because if you Google other countries, they've really had a very, very bad effect. But my staff have been innovative, my staff have been creative to make sure that at least we maintain our stocks, although we have a 16% decrease total in blood collection in Uganda, and this is attributed to the COVID effect. Before the lockdown, we are able to maintain our blood stocks, and we are collecting about 98%. We are meeting the target, because we have a target of collecting 300,000 units of blood per year, and each team has a target to collect 1,250 units of blood per month. So most of the teams, we are meeting these targets, and we are doing well. It's only with the COVID effect that has really had a negative impact, but we are trying to manage. We have approached the hospitals, we have asked them to scale down on transfusions, we have asked them to manage prevention. As you know, prevention is better than cure, at least if most of these conditions are preventable. If you get good obstetric care, because as we are aware, the government policy is free medical services to all Ugandans, and this is inclusive of the blood transfusion services. So we cannot charge patients, but on average, a unit cost of blood is about $88 to collect, to process, to store, and to issue, and to test, because no blood has to be tested. So it has been costed at $88. So the government has increasingly given us resources to be able to collect what we are collecting. But the main challenge we have now are vehicles, because most of our vehicles have grown old. And as you know, there was a ban by government on procurement of vehicles. So this ban did not spare UBTS, but we need vehicles because most of our activities are transport related. And if you look at the invoice for medical treatment in a private hospital, you realize that blood, if the patient has got blood, there is zero. But you know, these private hospitals, at times they have to buy the blood giving set, they have to cross match this blood, and they have to group. I think those are the overhead costs that they charge. And if somebody has bought blood, unless that somebody has evidence, but there's no way we can listen to rumors, but we need proof. If somebody has sold you blood, bring proof. If there is proof, then we shall take action. But many times people just say, I bought blood. But if you don't have proof, then there's no way we can take action. Let people bring proof. Let people maybe take numbers of the money that they've paid to somebody. Then we shall take action. But we can't take action against rumors. They can travel as far as Mubende, as far as Hoima, to be able to collect blood. So they need sound vehicles. And many of these vehicles, in fact, the Auditor General report had recommended that most of these, in fact, about 55 of the vehicles should be boarded off because they have lived out their lifespan. Many of them are more than 5 years. They've gone to 15 years. Many of them have done the kilometrage of 250,000 kilometrage. So they are really giving us a high maintenance cost because of their condition. Most of our donors, the schools are closed, and even the lockdown, donors would not come. We would call upon donors when you have to go and ferry them and come and donate blood. So with limited movement, so it has also impacted on many of our donors. And many times now we have had to rely only on repeat blood donors because we can't get first-time donors, as we have to go to them to be able to mobilize them to come and give blood.